And hello everyone, I'm Kerry Bull, joining you from Warren country. It's my pleasure and privilege to welcome my friend and colleague, Dr. Bonnie Keilty, to our inaugural conference to present our keynote address. Bonnie has worked in early childhood intervention for over 30 years, including research, teaching, practice, and national service. Dr. Keilty is Professor in the Early Childhood Development and Learning Diverse Children and Families program at Hunter College, City University of New York. Bonnie's research and published articles focus on family professional partnerships, prenatal supports, home visit planning and implementation, effective inclusion practices, and professional development and preparation. All of her work stresses the translation of research and theory to practice. Welcome, Bonnie, and thank you for joining us today.
Good morning. I hope you had a very thought-provoking and motivating first day of the PRECI conference yesterday, and I am very happy to be kicking off your second day of this inaugural conference. My name is Bonnie Keilty, and I am a professor at Hunter College, City University of New York, and I am coming to you from my home in Brooklyn, New York, in the United States. And this morning, we're going to talk about centering the family and family-centered practices. We'll talk a little bit about principles of family-centered practices with opportunities just to throw out some reflection questions, given the time, not time to actually reflect, but hopefully you'll take those with you from the session. And then I'm going to spend the last 10 minutes or so talking a little bit about my work, including the studies that are trying to evolve and move family-centered practices forward. So to get us started, if we could just take a quick look back and move forward, when we think about family-centered practices, boy, have they come a long way. When we think about how families have been participating in early intervention. So initially, families were really considered spectators. They watched while the professional and the family's child interacted, and interventions were directly provided by the professional. And as we understood the critical nature of families to both child learning and development, and also just as part of the family system, we really, the role of families has moved into being families as learners, where professionals share knowledge and strategies with families that the family then learns and can use and apply with their child. And even that has moved from professionals being more direct prescribers of interventions to now families as partners, where the interventions are designed together between family and professional. Strategies are identified, and then families contribute to all aspects of the intervention. And so when we think about different types of family-centered practices and interventions, we're really in the two boxes of families as learners and families as partners. And depending on the model of intervention, they may swing a little bit more towards professionally directed or more towards partnership-based. And the families as partners really recognizes and works within the concepts of child and family strengths, that we understand family culture and utilize family routines and materials to embed interventions within everyday family life, and that we use coaching to guide families in this process. And a critical goal in these family professional partnerships is promoting families' confidence and competence in helping their child learn and develop. So one reason is we know that when families feel confident and competent, that directly affects both child outcomes and parent-child interaction, which we know then subsequently affects child outcomes as well. And that is very important that we have that linkage. Just as important, I would say, is that promoting development is a part of being a parent. So for one to feel good about fulfilling that role of promoting their child's development is just as important when we think about family-centered practices and family-centered interventions. And as such, then, the professional's role is to support the family in being a parent, in recognition that how one chooses to parent is very value and culturally based. And we'll talk a little bit more about that. And so really, when we think about family-centered practices, it's really about the fact that promoting development is a parental role. The family is not being asked to become an interventionist. We are supporting the family in being the parent that they always envisioned and always wanted to be. And this really derives from the fact that when families have children with delays or disabilities, they do frequently feel uncertain and unsure. And that is something that we can contribute as early interventionists to families. So this was a quote from a family in one of my studies who said, when you have a special needs kid, you're always wondering, am I doing the right thing or am I not doing it right? So really thinking about one of our main roles is to promote family confidence and competence. And when we think about early intervention from that perspective, then the overarching vision really becomes that for each and every family, that parents get to be parents and the parents they envisioned. Kids get to be kids as the family envisioned their kids. And families get to be families as they envisioned they would within their communities. So when we hold this vision, then we can think about what are family-centered principles and how do these principles look to achieve this vision. So family capacity building principles really can provide us with a guide in supporting families to promote their confidence and competence. So the first principle is that whatever the individual family's culture is, and I'm defining that very broadly, not only an ethnicity or a race, but all the characteristics of how that particular family works, believes, practices, that is the culture of the family professional partnership. So early intervention works within that individual family's culture. And that includes both the what and the how. So when we think about the what of our early intervention work within a family culture, it is about parenting. And so what we need to think about is for that particular family, what are their beliefs about child development and valued outcomes? Because those beliefs are going to guide how they parent. What are their beliefs about parenting? How structured or how involved in different aspects of what the child is doing does that particular parent expect to be and want to be, and how might that shift our interventions? And then what are their beliefs about disability and intervention? And so this helps when we think about ourselves, what are our parenting values, approaches, and beliefs that are different from families you support? And this becomes really important for us to think about and reflect so that we can differentiate our professional knowledge, our expertise, our skills, our strategies, differentiate that from what are our parenting values, because we come to intervention and partnering with families to contribute our professional knowledge, not our parenting values. And this is one of my favorite cartoons to use to illustrate this, where one parent has their baby facing forward in their carrier, and another parent has their baby facing inwards in their carrier, and one parent says to the other, my baby is not on backwards, your baby is on backwards. And the reality is neither baby is on backwards. Babies are just learning different things and experiencing different things based on which way they're facing. Are they out in the world and learning about what's going on around them with their family, or are they saying you're safe and secure here in this big world? Children are learning different things, but families are purposely choosing which way they choose to do this based on their parenting values. So how do we practice in response to each individual family's culture? Again, we have to understand our personal versus professional self and keep those separate, trying to stick with the research and the evidence base as much as possible. That is what our expertise is. Thinking about how we can tailor that research and evidence base to each and every family. How is a particular strategy or idea going to fit within that particular family? If the same strategies look the same way in every family, then we're missing something there. So that's a good check for yourself. And then when there isn't evidence one way or another and families are asking for our advice, we particularly let them know that. We can share ideas if it doesn't have an evidence base, but we let families know that it's not the only way and that there isn't specific evidence that says do it one way or the other. So that's the what of the partnership. Then there's also the how of thinking about the family culture. And the how is how we partner with families. And this means that we communicate and interact with the family the way that family communicates and interacts with professionals. Some families are going to want to be much more formal. Some families are going to be much more casual. I call us chameleons as interventionists. We change our style depending. Thinking about how the particular family makes decisions and whose roles are what within child rearing. So when we think about decision making, there are some families where the entire family makes a decision together. But frequently when we do interventions, there may only be one or two family members in the home at that point. Thinking about how do we design our programs so that families have opportunities for the entire family to contribute to the decision making before a final decision is made. So if we don't see a family for even 1 week or 2 weeks in between, have home visits in between, what if we contacted the family the next day just to check in and say, hey, how did the rest of the family think about the strategies that we identified? And thinking about, how can we make sure that that works instead of waiting an entire 1 week or 2 weeks? When we create our intervention plans with families, if everybody's not there, can that intervention plan be temporary, give the family a couple of days for the entire family to contribute, and then finalize that plan instead of that plan perhaps just being done in one meeting and we're done. And also thinking about, how are families expecting to receive supports? Are they looking for broad generalizations that they're going to take and create their own, or are they looking for very specific coaching to happen? So we changed the way we even provide our coaching based on particular families' culture and how they want to interact with us. So when you think about your partnering values and practices, you might think you want to partner in a certain way with families, but that could be different from the way certain families that you support want to partner with you. So what practices can create responsive partnering? Well, first is intentionally finding out that family's partnership style. Practice it and then get feedback. Families frequently, this partnership idea is very new to families. They might not have partnered with anybody else, let alone in early intervention. So providing that opportunity, and families might change their partnering style once they get to know you more. And then also recognizing that families come with a history of interacting with different systems, and particularly marginalized families, those interactions may have been quite negative, and that could create them being distrustful, tentative in their creation of the partnership. And so how you engage with the family, it needs to recognize these systemic and historical interactions that families have had, and recognize that that is still there no matter how you are practicing with families. So being very cognizant of that as you're thinking about, you see how families respond to you and what your next steps are. And so within those practices is the mindset or the belief that we recognize and value the individual family's culture as they practice, and that does not need to be changed. And that it's the professional's role to tailor the practices, the what and the how to that family's individual culture. And that's how we partner within the family's individual culture. And this mindset leads us to our second family capacity building principle, that attitudes and beliefs can help or hinder the family professional partnerships. And attitudes and beliefs do guide our practices. We can practice in certain ways, but how, when we get down to the nuances of those practices, what we believe really matters. And we really need to believe that every family has strengths, and we really need to believe that every family's culture has value. And one of the things that I see that I worry about is how sometimes professionals act away from families. And it's really just as important as how we act in front of them. Because if we truly believe about family strengths, then we wouldn't be complaining about families when they're not around. These attitudes and beliefs are really practiced. We have to actively practice them. We all come with biases, and actively and consciously shifting what we're thinking about. Acknowledge that we don't know everything about families, and we don't have to. We don't know why families are making certain choices. It may emerge, and we can ask to a point, but it should be within our role as professional, not to see if our assumptions are correct or not. But being okay that we don't know everything. But if we truly believe that families have strengths and are making conscious decisions to make their family the best they can, then that's good enough. And also being careful not to overgeneralize families in general, overall, or families with specific characteristics, and say all families are certain ways. And finally, recognizing that families have different priorities than you, than me, and that we are working within that particular family's priorities versus our priorities. So the next family capacity building principle is in the form of a question. Are the professional team members treating the family the same as other team members, if not better? So thinking about how we team. So we say that the family is the expert on their child. Well, therefore, they bring vast knowledge and information to the team, and therefore should be held equal to other members of the team. So when we engage in practices such as that the professional team members need to get on the same page before meeting with the family, then you wouldn't do that with other team members. You wouldn't have two disciplinary team members meet to get on the same page before meeting with a third disciplinary team member. So we have to think about that. And if not better, because this is within the family. This is about the family's culture. This is about how the family wants to be a parent. So it should actually take more priority and certainly not less. And within this, then it's recognizing our power. As professionals, we hold a lot of power. We may not think we do, but to families who see us as the keepers of knowledge and expertise to help their child learn and develop, that is incredible power. And so what we need to do is give that power back to families. So how do we think about the family as a team member? We want to discuss all our perspectives openly and honestly. And that means that if professionals have disagreements, great. Doing it in front of the family allows the family to see why there's different disciplines on their team. And value families' inputs as important contributions, that it is a part of the team just like any other team member, and treating it as such. This also means being vulnerable and being open and comfortable to having to work on the spot, to have questions that you might not be sure of or you weren't prepared for. it's working through it as a team and working in that way. And then finally, thinking about the team is actually reframing this concept of denial. Professionals I see frequently use the term denial in lieu of families disagreeing with professionals. And if we used our teaming principle, we wouldn't say, oh, that physical therapist is in denial because they disagree with me. It's their perspective from their lens. Same thing for families. It's also being very careful, if there's a very fine line between denial and hope. And then the other piece is families recognize the stigma. The responsibility of the partnership lies in the professional. It is our job to create partnerships that families want to participate in. So we should not have to get families to do anything. So when the question is, how do I get a family? Right there, we have to back up and think about, okay, what do I need to do differently? How do I support families in ways that are going to make them want to engage? And these are sort of don'ts, but these pitfalls I see as ways of helping us to think about what could we do instead. So I see there are three areas in which there could be family engagement pitfalls: misunderstandings, mismatch, and missed opportunities. So misunderstandings is understanding why families need to be engaged. What is the family's role? What do families bring to the intervention? And these assuring family understanding around family engagement is really, really important, but it is not sufficient. And it's not sufficient because families can understand why they need to be involved in early intervention. But if there is a mismatch between the intervention and families' priorities and vision for their parenting, then they might participate, but not feel really good about it. So there could be a mismatch in the outcomes. Those outcomes might not match what the family thinks is important outcomes for their child, or those outcomes, how they're being embedded, might not fit. The strategies that we are suggesting families use might not fit their parenting style and how they want to interact with their child. And the routines, they may or may not be the routines that the family wants to be, including different strategies in. So misunderstandings are important, but if they understand, but we're still interacting in ways that don't match how that family wants to parent, then that could decrease family engagement too, because they won't feel good about it or they won't feel it fits them. And then the missed opportunities is the actual way in how we work. So how we are responsively partnering with families. And then finally, and all of this is really foundational to this principle, which is that family strengths are understood, honored, and utilized. So we think about family strengths all the time, right? This is something that early intervention talks about. So it is about these strengths-based practices. And we recognize family strengths by we are embedding learning into the family's routines and with their materials. We see those routines and materials as strengths for promoting child learning and development. We look at the child's strengths and build off those. And we look at what the family is doing with their child, and we see those as strengths as well. And our coaching practices recognize family strengths because we are affirming what families are already doing to help their child learn. What are those strategies they're using? And we're coaching new strategies. So we see that families have strengths in helping their child learn, and we see families have strengths in the ability to learn new strategies through our coaching. And so while broadly, those are all very important components of intervention, we do have to be careful that we don't fall into these pitfalls. So we have to be careful not to expect families to apply strategies the way we would apply strategies. They're not interventionists, they're parents. and how they interact with their child is reflective of that parenting style. We have to be careful if families are already using strategies that are working, and that strategies that they came up with. If we substitute new strategies for those already working strategies, then families are going to think what they're doing is not good enough. If we share ideas that conflict with what they're doing, so our new strategies, recommendations, or ideas, they can't use what they're already doing. If they use these new ideas, then again, it suggests that what they're doing isn't good enough and they need to use these other strategies. Those other strategies, though, might not fit their values and way of life. And then that gets in the way too. Families will either use them but not feel good about themselves because it's not the way they wanted to parent, or they simply might not use them because it doesn't fit them. And from a mindset perspective, we want to be careful not to practice in ways that assume families need fixing, that there is something wrong with the way they interact with their child. So when we think about these current strength-based approaches, it really focuses on the family as the middle person. We have interventions, we have strategies, we have knowledge, and we utilize the family's strengths in their routines and materials and in the strategies that they use and the strategies that they can learn. We use them to then impact child learning and development. And so this perspective really comes from the professional lens, what the professional thinks these aspects should look like. And so some of the work that we're doing right now is really trying to enter through a different strengths-based door. Instead of focusing on it from the professional lens, it's focusing on it from the family lens and what the family thinks their strengths are. And one family described this as this approach that we're using now. You're still doing the same types of things. It's how you're approaching it. And sometimes that makes all the difference. And so the idea behind it is really evolving family-centered practices even farther than families as partners to families as parenters, and really situating early intervention there, that what we are doing is supporting families as they parent their child in their role as being a parent. And to do this, we need to recognize that families are doers, thinkers, and feelers because they are parents. And that's what parents do, think, and feel. They think about their child's learning and development. And to start this off, we have to recognize that when we come into early intervention, families' lives are not a blank slate. They've been thinking about their child's learning and development. They've been coming up with strategies to help them learn. And those strategies actually fit their values and priorities within their individual family culture. So it's harnessing what we can learn about the particular family, but doing it in a way that we look through the lens of the family instead of taking what we learn from the family and look through the lens of the professional. It's nuanced, but it's critical. And when we think about parenting, interventions, which is basically anything we do, right, with kids, is a natural part of the parenting process. Research has shown that families are continuously making decisions of how they interact with their child based on their child's characteristics and aligned to their goals for their child. So how do we come to understand what families do, think, and feel from their specific lens? Well, what do? We want to understand how they're already helping their child learn and develop. And we already do observe, but I'd contend that we observe through the professional lens. We observe based on the outcomes or priorities that the family has. We observe based on what we think are effective strategies, or we might identify strategies that we think are not effective and therefore we can change up. And instead, it's observing with a lens of what do families do, period. And then let the families tell us if it's something important or not. And that way it's emerging from the family. And we need to observe and identify for families, because very frequently families think they're just parenting. If you ask them what they do to help their child learn, they might not know, or they might not be able to tell you, because they don't think about it in that way. They think about it as just parenting without realizing that just parenting is just perfect. So once we know what they do, it's understanding, how do they think about what they do? Why are they doing it? How did they figure it out? These can be hard for families to consider, because it might not have been way actively conscious, even though they were doing it purposely. They might not have realized they were doing it purposely. So giving them time to muse and just kind of talk through it. And then also understanding, how do they feel about what they're doing? How do they feel about it? Do they like doing it? Do they not like doing it? How successful do they feel it is? And just really understanding it and really immersing it in the family's words and what the family is telling us. Again, suspending our lens and really trying to come from the family's lens as a parent. And to do this sometimes helps if we shift our mindset to thinking of ourselves as just another trusted other for the family. So families have lots of people out there that they ask different questions and advice to, and we're many informal friends and family, parent groups, Facebook groups, and we're one specific trusted other who has very particular knowledge and expertise around infants and toddlers and young children, and child development delays and disabilities, and very particular. And so if we think of ourselves as another trusted other, rather than coming in from a professional perspective, then that can also shift our mindset, which could shift our practices. And we have a strengths-based intervention that we're working on that we call the FAM scale, the Family Strengths in Constructing Learning Experiences. And what we're trying to do with this intervention is really move from the focus on individual routines that require a lot of professional interpretation to focusing on individual interactions that allow the family to interpret what they're doing. We're moving from acknowledging family strengths that we've identified to honoring and utilizing family strengths that the family has identified. We're moving from practices that are led by traditional coaching practices and practitioners to being led by the family, because we truly understand what they already do, think, and feel. And we're shifting from teaching new information and skills through coaching to really supporting and augmenting family knowledge and skills. And so this is one of my areas that I'm working on now, is the family strengths and constructing learning experiences. Another area that I'm working on with my colleague Carol Tribbett at East Tennessee State University, and your colleague Kerry Bull, is the Envelope, which is a website, and the website is on the bottom there. We can also share it out. It's a website where we're having conversations about family strengths, and we're talking with both families and professionals who are really trying to push the envelope along in family strengths, and most particularly families who have been traditionally marginalized. And then just want to share one other project that I'm working on, which is for families, at least in the United States, if families have a prenatal diagnosis that makes them automatically eligible for early intervention, they actually are not eligible until the child is born. So the focus is on child services instead of recognizing that the families are already parents as they're in the prenatal period, and starting supports prenatally. So we've done a couple of surveys and focus groups, and we're writing up interviews that we had with families with prenatal diagnoses. And these were just 2 quotes. All families were huge advocates that thought early intervention should start prenatally, in saying that early intervention is a safe place to land, and early intervention are the people who are more likely to know. So families really saw a role for early intervention prenatally. And finally, I just want to leave you with when we think about the words we use and what are we conveying with those words. And so one of the things that we've been doing at the envelope is thinking about how do we describe early intervention? And one of the components that I've really been focusing on is thinking about in those descriptions, who's the subject and who's the object. And frequently early intervention is the subject and families is the object. So families are the receiver. Early intervention provides families. Early intervention supports families. And so thinking about how do we shift the script a little bit so that families are the subject, and then positioning it within how all families parent. And so this is a description that we've been working on. Parenting is a group effort. Parents decide who to go to for what. Early intervention can serve as another trusted other. Families use early intervention to brainstorm ideas, share information, and be a sounding board around child development and any other family functions that the family chooses to ask of EI rather than their other resources. So I share that with you to sum up the presentation portion of this session, and I look forward to your questions in the Q&A. Thank you.